Hi, everyone. Hope you are well. My name is Charlene Artilio. I'm the director of the Student Assistance Program at Merakey. We are formerly known as NHS. Our agency changed our name on April 1st, and you heard from some of our colleagues in the Central West region, one of the last calls, talking about their use of the tool in their area. So I'm going to talk a little bit about our involvement in Delaware County, Montgomery County, and Philadelphia. Tita, you can change. So just a little overview. You all know this, but staff operates totally different in every county. In Delaware County, we're not using the tool, but we're in the process of discussing, how we can apply the tool. But there we have 3 full-time SAP liaisons in 8 districts, primarily serving middle schools and high schools. And they really work more as in that case management type of role with assisting families with linkage to services, applying for medical assistance. We have the capacity to co-facilitate groups, psychoeducational groups with school staff members. But there, the program, there's one other provider in the county who provides similar services. So we're figuring out how we're going to be using the tool there. Where we have used the tool is in Montgomery County and Philadelphia. Montgomery County, which Maria from Carson Valley will be talking a little bit about Montgomery County as well after me, but we have a combination of drug and alcohol and mental health funding in Montgomery County, so it's our urban region. And really, the service plans are based on the school needs. So our program, although we have 6 SAP assessors, some of them are full-time, some part-time, and some fee-for-service based on the role that the roles in their school districts that they're assigned to. And we had to get a little bit creative, with the way that we were staffing based on the funding that we received. And there's been a strong emphasis on, the unilateral use of the tool in the county. So the other providers are using this tool as well. We do provide screening through funding through the Office of Drug and Alcohol and through our mental health offices where we're providing the assessments. Our specific agency, we're providing services in 4 school districts, K through 12. And lastly, in Philadelphia, we have 3 full-time assessors who their primary function is the assessment and linkage. So we have 97 schools in Philadelphia urban region, and we're using the tool as a part of the assessment, and we're funded through the Department of Behavioral Health Office of Addiction Services. So Tita, you can flip to the next slide. Thank you. So in Montgomery County, as far as what our feedback has been, I think the tool, it streamlined what we had already been doing for assessments and condensing some of the paper and pen and paper screening batteries that we were using. So the assessment, that part of the process is taking a little bit less time. I think, we're getting a positive response from the schools and staff in terms of just, there have been multiple changes around how we're providing assessments, one being we're providing them on site at the schools versus having the families come to our office. But in Montgomery County, we've gotten a positive response from that transition. We always ask the kids their feedback about using the tool. For the most part, they're okay with it. They're doing it. They appreciate the technology piece of it and the access to the iPad. Parents are already, required to come to the assessment. And so for them, there have been questions about, where the data is held and just the confidentiality piece of it. How's the data going to be used? Once we explain that information, they're on board with it for the most part. We've gotten very few parents declining their child's participation. In Philadelphia, the process looks a little bit different. We are getting a little bit more concern from parents. Now, one thing that I will mention is in Montgomery County, we use the school version of the tool. And in Philadelphia, just recently, we've added the school version as an option, but prior to, we were only using the PCP version, which includes questions about sexuality. So we were getting some parent concern about their child participating in some of the information or based in the questions asked. trying to think if there's anything else to mention there. I think we're good on this slide, Tita. Okay, so like I said, Montgomery County, we started implementing in 2016. In Philadelphia, we've been implementing since 2015. Some of the success and barriers, like I mentioned, just the subject content. Some of the kids, and we find this there to be more questions in Philadelphia versus Montgomery County about some of the language of the tool. So some of the assessors are taking time to explain more about what the questions are and making sure that the kids understand what they're answering. And as I mentioned, the school versus pediatric version, parents seem to be more comfortable with the school version for the most part, that don't include the sexuality questions. And that also kind of leads into the age appropriateness, just questions that families had. And we fortunately were able to offer the school version in Philadelphia for parents who might have concern about that pediatric version. Again, we ask, the parents and the students, what their response is to having the tool utilized. I think a lot of the response, comes down to how is the assessment presented. There are definitely circumstances where the tool or the assessment might be directed more as a punitive measure, and those are the ones that we tend to have more reluctance with participation in the tool. We're definitely explaining to families it's a partnership. We want to have the conversation. It's not a punitive measure. We really want kids to be successful and to get linked with resources in their community. But we know where we get the more of the pushback is when it feels like a more punitive measure. And the other piece, one of the barriers that we're definitely working through is, this is all new. So there definitely have been some, I would say, we had to work extra hard in some counties for that assessor staff to buy into the tool, especially if they've been in SAP for a long time. And there have been changes in how SAP in all of our counties really has been implemented. So you just, sharing the information, sharing the why, making the staff part of the process, but then also just supporting them. And, it's changing, it's different. So you can flip to the next slide, Tita. This is the gender breakdown. So males versus females. We're getting, while the breakdown, it's almost 50-50, which we would expect. The transgender and the I don't know, there are more kids, I think, that in our schools that we're supporting in that transgender area, but not necessarily identifying on the tool. All right, and then you can flip to the age breakdown. Now, what I will say, which isn't evident on this, and again, I'm sure other people are experiencing, is we're getting a lot more referrals for the elementary level. Kids are coming to school, and elementary staff are really having to deal with some issues that we weren't seeing until 5th, 6th, 7th grade. Anxiety and depression, and that's going to come up on the next slide as far as like different areas that the kids are endorsing. But I'm really curious to see, how the child version of the tool, the parent version of the tool is going to demonstrate, what the risk factors are for these younger kiddos. And I'm willing to bet it's going to mirror, what we're seeing for the older kids. If you want to flip to the next slide, Tita. So the suicide and related risk factors endorsed by students, and you're going to see this information in both Philadelphia and Montgomery County. A bulk of our referrals are for more of the depression and anxiety symptomology that the kids are experiencing in school. We know that there's more substance abuse and substance use, and those referrals are not being captured. So I think, part of what we've talked about as providers in the counties is educating the school on, how they can identify kids that might be at risk for substance use or substance abuse and make those referrals, and the education behind it. I think another piece of that is just that the perception of use, where kids, staff, they might not be identifying a need as early as we could with some of these kiddos, especially with using marijuana. And you guys have definitely come across as not on the tool, but vaping is like the new thing that we're dealing with at a pretty high rate, you know, with disciplinary issues at schools. Okay, so we can flip to the next slide. Thank you. So, I mean, in summary, we've had a lot of success with the tool and the acceptance of the tool, and just finding its place. You know, it's a part of the assessment process. So we're balancing the utilization of the tool with either doing kind of like a biopsychosocial type assessment, or just having a conversation to get more information and clarifying some of the answers that the kids are giving on the tools. And like I had already mentioned, you know, there's the demonstrations the mental health is more easily identified and referred to SAP assessments. So we have some work to do in supporting our schools with the identification and referral for drug and alcohol. And then, again, symptoms of depression and anxiety are what we're seeing the most. And that's it.
Great job. Thank you.
Thank you.